My name is Vanessa Fenley, and I'm the director for Homeward 2020. We're a community initiative here in Fort Collins, and it's our vision for Fort Collins to make homelessness rare, short-lived, and non-recurring. And we want to see that done by really driving the implementation of a 10-year plan. We are thrilled to partner with all of these sponsors and honestly dozens of people in order to make this community conversation a reality. And I'm particularly pleased to introduce today Jamie Van Leeuwen. He's a guest with us today from the governor's office, special advisor to Governor Hickenlooper, with extensive experience working in homelessness, and was actually pretty critical in helping us design the initial framework to form the 10-year plan here in Fort Collins. And he's come up from Denver in order to provide some opening remarks and participate in today's conversation. So please join me in welcoming him.
Thank you so much. Well, I'm really excited to be here, and I had the privilege of being part of a lot of the dialogues that happened in this community many years ago when we started talking about Homeward 2020, and Chris Nealand was crazy enough to call me and ask me if I'd be interested in having the conversation in Fort Collins. And I've lectured about Fort Collins a lot as I've done more and more on homelessness around the country. And I will tell you that your community, as you continue to address this issue and wrestle with this issue, it's a complicated issue, your community was a community that, rather than waiting till the problem got so big that everybody was complaining about it, you all started talking about it before the problem across the country had gotten so big. And it's very, very encouraging when a community decides to be proactive about an issue. And you still, obviously in your community, are wrestling with homelessness. But your approach to it in terms of the way that the police and the city manager and the city council took this on was really inspiring. It was something that I had not seen in a lot of communities around the country. So I just really want to compliment you all. And I'm honored. People kept thanking me for driving from Denver. I was more than happy to get out of Denver, the legislative sessions in session. So I was more than happy to come up and be with you all, because I think what you're doing is extraordinary. We should give an extra round of applause to Vanessa Fenley and her leadership and what's happening here. And so Vanessa, thank you. And dear friends, in addition to the folks who are on there, Cheryl Zimlick and Chris Nealand have been such unbelievably good partners and good conduits in terms of keeping us connected to what's happening with homelessness. And so I'm the person when they call and they say, can the governor come and give some opening remarks? I have to call back and say, well, the governor can't be there today, but I could come. And then you all have to pretend like you're excited that I'm here. And so, but the governor was here. He would talk a lot about what it takes to address the homeless issue. That it's not just the right thing to do, but as you all know, it's a smart thing to do. That as you start looking at your costs and the impact that homelessness has on your community, that increasing supportive housing is really going to make the difference. I don't know, how many of you guys saw the Jon Stewart piece just recently on housing? If you've not, you have to Google it. It's this crazy idea. Jon Stewart sent his reporter all the way out to Utah to find out why there are fewer homeless people on the streets, and they couldn't figure out why. The reason that there are fewer homeless people on the streets was merely because they put them in housing. And as you all are finding out, if you look at Red Tail Pond and the 40 units of permanent supportive housing you created and the 20 additional units of low-income housing you created, that takes 60 people who would not have access to those resources and moves them off the streets. And so, as we're addressing the homeless piece, and especially at the state level, I believe that if we're going to be good partners with our communities around the state to address veterans' homelessness, to address chronic homelessness, to address family homelessness, that we need to do a lot of what I was just talking to Chris about, that Fort Collins has done an amazing job of not just talking the talk. You didn't just write Homeward 2020 and say, here's our plan. You actually started walking the walk. And I believe that our state has to do the same thing if we're going to partner with you and say that we really want to be part of ending homelessness. And if you look, in 2014, across the state, we were able to develop 170 units of permanent supportive housing. We were able to move 200 residents, 23% of whom were veterans, into the Fort Lyons effort. We were able to house 38 of those folks that we housed were from Larimer and Weld counties. That $30,000 in HUD technical assistance came into our state, $100,000 from the enterprise community partners, $600,000 was committed by the state human services for a parolee housing initiative, $3.5 million were committed from the Division of Housing, and 125 vouchers for permanent supportive housing. And so a lot of those resources that came online were because of the advocacy that happened in this room. And so as we move forward and as the governor moves forward into a second term that we're very excited about, we're excited about partnering with you all on homelessness, and we want to continue to ramp up our efforts that the governor has called for. Just in the next year, we want to partner with our communities, with our housing authorities, with folks like Homeward 2020, and our goal is to bring online another 500 units of affordable housing in our communities for the homeless. And so we're looking very, very forward to working with you. Where's Zach? Zach Schaffner is here from the governor's office. It's great because I get to stand up here and talk about all this stuff. We have folks who are really doing the heavy lifting right now, and we have an amazing team of folks, and Zach is one of those. And I really want to make sure that we send the message. I was walking in and somebody said, well, thank you for driving up here to be part of this. We have to be driving up here to be part of this, that we should be driving up here to be part of this. And so my message today is not to come here and talk at you and tell you what you should be doing to end homelessness. My job from the governor's office is to say we are delighted that on a snowy afternoon, you guys pack a room full of your elected officials, full of your law enforcement and public citizenry, and are here to talk about this. We should be at the table with you all. And so we're hoping that you'll call us to act and tell us what you need to do to really make your efforts here successful. So on behalf of Governor Hickenlooper and Lieutenant Governor Garcia, 1,000 thank yous for all that you're doing. And we just look forward to working with you more in the future. So thank you very much for having me.
So we had a great conversation this morning, and we're really looking forward to the conversation again this afternoon. And to just start things out, we really just wanted to provide a short presentation with some information from Fort Collins as well as from other communities across the country on homelessness. As I mentioned, Homeward 2020 really drives the implementation of a 10-year plan to make homelessness rare, short-lived, and non-recurring. And that 10-year plan is based on evidence-based strategies and best practices that we know will help us move that needle. And people often ask, okay, you've had this 10-year plan, it's been going for about 5 years now, what's really been done? But we've seen in Fort Collins that we have made some progress. We've been able to increase the permanent housing options for veterans, and now with Red Tail Ponds coming on, really for all residents who may be homeless. We've been able to increase our mental health and substance use and really medical opportunities and treatment for individuals through Medicaid expansion. We've implemented a street outreach program with the help of Homeless Gear. We've been able to increase shelter options for families, rapid rehousing options for families, as well as enhance transitional housing options for youth and for families. We've also implemented a cold weather emergency shelter program, and all of these things are, I don't want to give the impression that they are things that Homeward 2020 did, they are things the community did, and it really shows the power of what we can do when we put our mind to increasing some of the resources that are really needed to make an impact. So we also wanted to provide a little bit of information about homelessness in general, and we know that there are several definitions that are used, and so just to provide, again, a little bit of context of when we talk about homelessness, the diversity of what we may be talking about, and so as clear as we can be as far as who are we talking about and what are some of the responses that may be needed. So at the very top of the pyramid, we have people who are unsheltered and homeless. They're sleeping outside in a vehicle in an abandoned building, really someplace that's not fit for human habitation. The next level is something that we call literally homeless, and that really means that everybody that's sleeping outside in unsheltered areas, as well as people who are staying in our emergency shelters. And then we have HUD's definition, that's the Housing and Urban Development, a federal definition that includes everybody who's literally homeless, plus people who are staying in transitional housing programs. And then finally, we have our broadest definition. And this includes everybody who really just doesn't have a permanent residence of their own. So they may be staying doubled up with friends or families. And this is really a definition that we recognize at the community level, even if it's not incorporated into some of our federal definitions that may guide funding and some of those strategies. So some of the numbers. Nationwide, On a single night in January last year, 610,000 people were surveyed, and these are only individuals who were staying on the streets, staying in our shelters, and in our transitional housing programs. So all those people at that bottom tier, that broadest definition of homelessness, not everybody's included in that number, and so that's why it may seem low, even though 600,000 is startling. In Colorado, we had about 9,754 people. And then here in Fort Collins, we surveyed 289 people. So I know that number looks low, especially when you compare it to the state and to the country, but what we did was we actually divided that number into our total population for each of those entities. And you have a proportion of our population that's about 0.19% that qualifies as homeless. And so you can see for the size of Fort Collins, we are dealing with an issue of homelessness, and it's something that we can solve. So here in Fort Collins, we do our point in time survey. Again, that's kind of a survey where we go out on one night and survey everybody who we can find who's homeless. We do that every January. We're doing it next week, but we also did it last summer. And what we found last summer was that 41% of people who were surveyed had first become homeless here in Larimer County. About 20% had come from elsewhere in the state, and the majority of those people were from surrounding areas, so Weld County, Boulder, Denver, and then 39% had come from outside of the state. And Heather, our facilitator for today, will talk a little bit more about what it looks like in other communities and what those data look like nationwide. We also asked, for those people who did come here from out of state, why did you come here? And these were the top 3 cited reasons. The first one was to be with family and friends, really to be around that support network. The second reason, actually tied with the first, was for work or education. They thought there was a job opportunity or the opportunity to become better educated here. And then kind of that third highest cited factor was for quality of life or community reasons. So these were things like the weather's nice, I like living in the mountains, it seems safer than Denver. That was a response that we got a couple of times. So really just people seeing what an incredible community Fort Collins is and wanting to be a part of it. We also asked, why do you think you became homeless? Why are you in your current living situation? And the most cited reason, as it may not surprise you, had to deal with financial reasons. Their rent was too high to make it, they were underemployed or unemployed, or their wages were too low. Health or a disability was the second most frequently cited reason. And then the third was that their family status somehow changed. So there was a divorce, there was a breakup, there may have been a death in the family, and for them, that was enough to launch them into homelessness. So now that you know a little bit about Fort Collins, I want to turn it over to our facilitator for today. Her name's Heather Lyons, and she's from an organization called CSH. And she's going to talk a little bit more about homelessness on the national scale and then kick us into really the good stuff for this afternoon.
Thank you. Hi, good afternoon, everyone. My name is Heather Lyons. I work for CSH, which we're the organization formerly known as the Corporation for Supportive Housing. We officially just became the acronym about a year ago, and I still struggle without saying what CSH means. So, we're a national nonprofit organization. We have offices in about 14 locations throughout the country, and in those offices, we help communities and states build and create supportive housing for most vulnerable people. We also have a couple of national teams. I am on one of those national teams, our national training and consulting team, and I live in Portland, Oregon. I have lived in Portland, Oregon for the past 16 years now, and I love living there. I don't get to work there as much as I used to, and so now I get to travel to a bunch of different places and meet a lot of wonderful people working on this issue. Prior to joining CSH, I did work for the city of Portland for 7 years on issues around homelessness, and so I have a very strong community context in terms of what happened in Portland still, even though it's been a few years since I worked there. So one of the things I want to share is that I heard in here there are some concerns that maybe sometimes the services that are available, or sometimes there are people who come to Fort Collins because people want to be housed here, or it's easier to be homeless here, or something like that. I just want to share, these are just a few slides to show you that everybody's concerned about that. Seattle's concerned about that. I know for sure Portland was concerned about that. San Francisco's concerned about that. A little closer to here, Boulder is concerned about it. And Portland, Maine also had the same concern across the country. and Santa Barbara as well. So all over the country, people have these concerns that providing supportive services and housing for homeless people may draw homeless people to the community, and there's nothing wrong with having that concern, and I think it's a good question to raise. The thing is, though, is that there's been some studies done on it nationally and in several localities, and Vanessa shared the information around Fort Collins, and what I'm going to show you is going to probably ring true. What she talked about rings true with a lot of communities throughout the country. So nationally, Martha Burt, who was formerly with the Urban Institute and has been a homeless researcher and guru for a very long time, a really amazing person, she cited a study that said 75 to 84% of people remain in the same area where they lived before they became homeless. So there are people who move, there are people who travel, for sure, but a vast majority really come from the community that they lived in before they lost their housing. In Los Angeles, there was a study, and Los Angeles is, as you know, huge, and this was done in the county, and this is a study just of homeless men, single men. And what they found in Los Angeles is that people moved throughout the county, people moved throughout different parts of the city, and a large part of that had to do with the location of resources and supports. So people do move where there are supports and where there are resources. There's no question about that. But what they also found is that the majority of homeless people were stayers rather than movers. So while they may go to different parts of the county to access different resources and different housing and different supports that they may need, it's not like they travel to San Diego or they come up to Portland or they go, to Arizona to access services. They may travel, but it's not necessarily to get the resources and services. People tend to stay closer to home for that reason. That said, people do move and people do move around. So what we found in Portland, in our 2013 street count, we just do it once every 2 years, and we're getting ready to do ours again next week as well. 59% of the people surveyed in our point in time count lived in the Portland area, or Portland proper, for 2 years or more. 20% lived for less than 2 years, and were homeless when they arrived. So that's an important point. So 20% of the number. And then the most common reason for coming here was family and friends. So it's along the same lines of what you found in Fort Collins, or what Vanessa and her team found in Fort Collins. And then for people who came in, if they weren't from Portland proper, they were mostly from suburban areas around the Portland region and from other parts of the state where there just aren't as many resources as there are in Portland. And by resources, I don't just mean social service resources or homeless resources. There's more jobs. There is more housing. There is just more resources in general in cities than there are in some suburban areas and rural areas. So that's what we found in Portland. And I believe that's it for this. Yes, so that's the context we wanted and the stage we kind of wanted to set. But now we're going to turn to a community conversation, and we're going to do this via a fishbowl process. You'll notice you're sitting in a circle. We are going to spend about 40 minutes talking to the folks who are in the inner circle. We're calling them our inner circle experts. And during that 40 minutes, we are going to encourage folks to have a dialogue, speak from their perspectives. They come from a number of different backgrounds related to this issue. While that's happening, we ask you just sort of sit back and observe and take notes of things that you find interesting that they say. Then we're going to turn it over to the larger group. And when we turn it over to the larger group, they don't get to speak anymore. They've had their opportunity to speak. So we want to focus the conversation on you all. And one way we want to do and make sure as many people as possible get the opportunity to speak, we're going to ask one person speaks at a time. If you've had an opportunity to speak, we're going to ask that you kind of sit on your hands before you raise it again so everybody can get an opportunity to speak. So make sure you get your priority comments out there. And we're going to get to as many people as possible. And if we don't get to you and you have something you want to share, or you want to share it but don't feel like raising your hand, you can use the back of the evaluation. And Vanessa will talk more about that at the end just as part of next steps. But there are many opportunities to share. So are there any questions about the process or what we're doing moving forward? Hi, everybody. So why don't we just start with brief introductions?
Cool. Absolutely. Yeah. Good evening, everybody. I'm Jeff Mihalik. I'm the Deputy City Manager here in Fort Collins.
Hi, I'm Jean Bosch, and I'm the manager of Old Town Library.
Hello, my name's Ryan Hodak. I'm the owner of Social, The Melting Pot, and Rodizio Grill.
I'm David Root. I'm the Executive Director of Homeless Gear.
I'm Zachary Penland. Up until 3 weeks ago, I was running the Murphy Center for Hope, and now I'm with the Housing Authority, and I'm going to be running the Red Tail Ponds project.
Afternoon. My name is Matt Robinalt. I'm the Executive Director of the Downtown Development Authority. My name is Todd Hopkins. I'm a Fort Collins police officer.
Jeremy Stafford. I am currently homeless.
So the first question, and whoever wants to jump in and answer, please share from your experience. So this is a complex issue, but what is the one challenge that you think should be, if you could pick one thing to be addressed first, what do you think that should be?
I'll jump in again,
Okay.
like I did this morning. I really think our challenge is to immediately find housing for people that are situationally and chronically homeless, but that's really the first step. The bigger, more complicated, complex issue for us is to make sure that once we get them in the housing, that they don't become homeless again. That's the bigger, broader, more complex issue.
Right. Yeah.
I think perhaps one of the early wins and low-hanging fruit is to establish a common vernacular, a common vocabulary in the community, so that when we do talk about this complex issue, we're all using the same words and we're all speaking from speaking the same language when we address the issues and seek solutions.
Mm-hmm. And I agree. A lot of us who are sort of in the field and in the work around thank you, who are in the field and in the work around homelessness, we tend to get stuck in our language and we assume everybody understands it, and that's not right. So, yeah.
Well, I think we risk finding ourselves in a bit of a stalemate. Just to go back to the point that you made about whether services are attracting people here, whether we're sort of a magnet community for transients or for people experiencing homelessness. The numbers that you showed, that Vanessa showed, demonstrate clearly that yes, there are some people who do come here citing our services, in particular people from surrounding communities. But I think that misses the bigger point, the bigger picture. I don't think the solution to that problem is to get rid of services. If we were to get rid of the services that we have in the community, I think we would see we might have those 100 or so people move along, and we might not see the transient population coming here each summer. We might see some decrease in that. But what we would see is the several hundred people, the vast majority of people experiencing homelessness, they would be farther away from self-sufficiency. I think that they would be using community resources, more expensive community resources at a higher rate. And ultimately, I think we'd see a more visible, expensive community problem.
I think along with what both David and Matt said, it is such a complex issue that I think data is incredibly important. Using the same vernacular is definitely part of that. But having good quality data, will make a huge difference. It's such a complex issue. Every community looks different. Every person who experiences homelessness looks different. Some are homeless because of a loss of job. Some are homeless because of a significant mental health or physical disability. And until we really understand, first of all, who is homeless in our community, it makes it difficult for us to target services to really address what they need. And then once we do start really focusing those services, we need to have a mechanism in place to collect data to see if those services are actually being effective, so that we can use our limited resources in the most efficient way possible.
I would actually suggest some mental health on that too. Some people, including myself, when you become homeless, you get a state of mind it's hard to get out of. It's pretty much every day. To have some type of mental health or a way to express yourself correctly would help. It would be less frustrating.
I also think that to back up the data and the common vocabulary and the getting around the acronyms and everything, putting all of that together and having more community education so that our community members from this very involved group here, who's clearly very interested, but beyond that group of folks, we can get the general public understanding that being homeless isn't a crime and that it's just something that happens, and we're all hoping that it's a temporary experience for people and to move them on from there. So I think some community education would help too.
I think with regards to communication being a big hurdle to overcome, in that there are a lot of silos. You have the faith-based organizations doing their thing, certain nonprofits doing their thing, government entities, the police force doing their thing, and government entities doing their support work, and business people like myself. who all want to see a solution, but are all sort of not talking to each other. So this is a good first step, you know, coming together and sort of identifying where there might be overlaps and wasted effort and where there might be gaps, and those gaps need to be filled in. That's a good first step to solving the problem.
Okay. Do you have anything to add, Todd?
I don't have much to add. I think the coordination, the appropriate coordination and tuning of the resources would be just my overlaying comment, in that I think it discusses the resources and the types of them, the educational component, the common vernacular and everything. So the coordination and the tuning of those, of all of the resources, and as I mentioned earlier today, this room is a fine example, this audience and its participants is a fine example of all of the positive energies that we have on the topic.
Can I just add something to that? Of course. Just hearing what everybody's saying and hearing what we said this morning, and it was roughly the same. And I feel like the common thread among what we're all saying is that really what we need is just to all be on the same page as a community. We have so many different stakeholders in the room today, and really everything that everybody said comes back to just we need to get to a starting point that we can all agree on, and once we're at that starting point we can move forward. But right now, I like the use of the term silos. We're all sort of doing our own thing. And we need to get to a point where we can move forward together, doing our things, but doing them together.
So today is a great start, but we can't do today every day or even like once a month. It would probably be too much and people would hear the same conversation again and again. So what is like the next step after a conversation like today that would sort of start cementing those relationships and coordination?
Yeah, based on what we heard just a couple of minutes ago from everybody, one of our easy first steps to me and low-hanging fruit is to really perfect our triage system.
Right.
I think right now when we do encounter a homeless person for the first time in particular in the city of Fort Collins, we don't know exactly always where to send them. We have so many valuable resources, so many excellent service providers, and really don't have a common platform or method to send them to the same location. Right now we rely so heavily on the Murphy Center, and they do a great job, but we can't always get them to the Murphy Center. So I think having a common platform and menu of the different services that we could provide in the community, and having everybody that encounter homeless people in the community, whether it's the police or others, to be able to go down that list and say, you know, your unique issue and your unique challenge that you have today as a homeless person, this service provider can help you. So I think having that list and communicating it well, which is everybody brought up earlier, is a really good first start for us.
I agree with that.
I would say along with that, you know, also finding a way to engage the broader community. You know, I think we don't want it to simply become something where we just tell people, well, go over there, you know, I don't want you here, so, you know, this is where you need to go, but really have it be something that everybody is part of the solution, and making sure everybody is aware of what services are available so that we can get people, you know, properly directed to the appropriate service. But then, you know, having that only be the starting point for people, that, you know, everybody in our community finds some way that they can connect to this issue, that they can engage in the issue and find some way that they can actually help out.
The general public education is a good first step, is educating the those not in this room. You know, I'm always thinking about who's missing, and you know, there is a perception of homelessness that there's like a tip of the iceberg that the general public sees and has some distaste for, and then there's this whole iceberg of homelessness that the general public doesn't see, and is in, you know, support housing or in certain support roles already. So educating the general public about the need, what's being done, what's being addressed, and so on, would be a good first step.
Anything else? Even if you said it this morning, it's a different crowd. So.
I'll go ahead and jump in again.
Yeah.
So we heard very briefly about Homeward 2020's 10-year plan, and I think to others' points, the education on that is critical, but I think we all agree that that probably needs a refresher. And I think we have much more community partners more involved in the process now. And I think collectively working very closely with Homeward 2020 and the City of Fort Collins Social Sustainability Department, we can update that plan, number one. Number two, have it more broadly understood by the community, and then task out those responsibilities that are part of that plan. And then make sure there's accountability on who's responsible for the different elements and actions within that plan. And then very importantly, we have to measure it to make sure that whether we're being successful or not. So again, set a plan, communicate it, task it out, and then measure success. I think that's a critical, not first step, if you will, but next step, I think, for us to really communicate that. Because it's a community, homelessness is a community issue. It's not the government's issue, it's not the service providers, it's a community issue. So we all have to have buy-in to that plan, and we all have to take responsibility for implementing it.
Any disagreement with that?
No.
That's good.
I think when it comes to serving people experiencing homelessness, I think there are sort of two things we need to think about. We need to be serving people who are currently homeless and sort of working within the realistic constraints of being homeless, but then at the same time we need to be working to address the bigger picture, the bigger issues that are causing people to become homeless, causing people to stay homeless, and ultimately what can we do to end the problem. And I think sometimes it feels like we need to do one or the other, but I really don't think that's the case. I think that we can be working in the short term to streamline the system of services that we have in the community so that people who do experience homelessness don't experience homelessness forever. And while they're experiencing homelessness, they're able to connect quickly and efficiently to the resources that they need. And then at the same time, I think we can be working at the community level, as we are doing, to develop new housing options, permanent supportive housing, more affordable housing options. So I don't think it's really a matter of one or the other. I think we need to be thinking about the things we can do in the short term, just at the same time as we're doing the things to set the stage for the long term.
One thing I'd like to comment on too is a few of the homeless, some I can speak for myself, I'm waiting for Section 8. Under Section 8, I have to be homeless. No car, no hotel, not a friend's house. I have to be on the streets. That's what they tell us we have to be. The city says that's a crime. So we really don't know where we're supposed to be sometimes, because if we don't get the lottery at one of the homeless shelters, you don't draw that card, you're on the streets. You're a criminal for the night. We don't know what to do sometimes. And I see all the effort everyone's done here, and I really appreciate it. But I kind of feel like I don't know what to say, because it's kind of from a one-side point of view, it seems. From a homeless person, we don't know any of this is going on half the time. We just go to our facilities, we do what we say we're supposed to do, get our IDs, wait for low-income housing. It's a long wait.
I think that's another part of the education piece. We talk so much about, well, we need to educate the broader community about what's going on, but I think we also at the same time need to be engaging and educating people who are experiencing homelessness or might experience homelessness. I think we definitely can expand upon our prevention efforts, but a lot of times people qualify for prevention services and don't even know they exist, so they become homeless simply because they didn't know that a service existed. People who are currently homeless don't know what services currently exist all the time, and definitely don't know about and aren't necessarily engaged in the creation of new services or new housing. So we definitely have to educate the broader community, but we also need to make sure that we're not forgetting about the people who are actually experiencing homelessness when we're doing that.
So as Vanessa presented, and it's also on the back of the agenda, there's a number of different types of homelessness, and this is also part about starting to learn the same language and talking in the same way. And so when you say somebody is homeless, it can mean a variety of things depending on who you're talking to. Thinking of that, knowing that there are families with children who are doubled up and tripled up, there are young people who may be experiencing homelessness for a variety of reasons, and there are people who are homeless and on the streets, and there are people who have been homeless for a very long period of time. What we another word we like to call chronic homeless, people who have been homeless for a very long period of time and often have either some chronic illness or other disability that is in addition to the lack of housing, preventing them from becoming healthy and stable because they don't have the supports they need to address those issues, nor the place to do that. How do you think the community would respond in terms of prioritizing, knowing that there's all these different experiences of homelessness? A lot of communities, based on the federal plan, are being asked to prioritize chronic homelessness as well as homeless veterans. Is that a comfortable conversation for Fort Collins, or is that a little bit uncomfortable? Because, you know, what about the families with children? They're important, and they are important too. So how does that conversation work here?
I think it's a very difficult conversation
Sure.
because you don't want to serve one group at the expense of another. But when it comes to, I mean, if you think about it just from a resource allocation point of view, if you have a small segment of the homeless population, the chronically homeless population, consuming a disproportionate percentage of the resources, which is the case here, it is the case statewide and nationwide, then it stands to reason that if you want to effectively address the broader issue of homelessness, the first thing that you should be thinking about is that chronically homeless population. And once the chronically homeless situation has been solved or at least reduced, theoretically you would have a lot of resources freed up to work with other pockets of the homeless population. Having said that, it doesn't mean that you, I mean, it's sort of back to my point earlier, it doesn't mean that you have to do just one thing. It doesn't mean that you just have to focus on the chronically homeless population and just forget that there are families experiencing homelessness. There are plenty of things that we can be doing. But if we're talking about where our focus should be, bigger picture, I think I would agree with that assessment.
I don't think the situation stays static over time. I think different influences that we don't necessarily have control over as a community will cause the ebb and flow and force different needs in these segments of the homeless population. And I think something that's adaptable is important. Some type of system that's highly adaptable to those changing needs.
Jeff used the term. First, I might suggest that prioritization may be important to a point, but I would be very cautious about a priority system or a list or whichever. And I like the term that Jeff used, and he used triage. Mm-hmm. And triage is certainly not an art, and it's certainly not a science, and it's very situational. And I think that may be more of an appropriate practice is triage. And because every situation is a situation, and the prioritization would be, I guess I would caution us to author some priority list of demographic. There's no equity in that, and the triage for me feels much more suitable for this topic.
I would agree with that too, that need-based is very important in the city, and I've seen need-based assistance work faster than going through the usual channels. I see people that don't become homeless again once they've been given their Section 8 with therapy or with assistance or just counseling. This Red Tail Ponds is a very good idea because not only does it have on-staff, it has surveillance, it has private gate. It's very secured, it's very watched, and it's got backup and resources to help anyone there if they're in crisis. So I think that's a very good step of keeping people from being chronically homeless.
And when you asked about, the community sentiment regarding prioritizing certain groups, I think what I saw play out in the papers this summer was a argument in the comments sections about certain behaviors,
Sure.
as well as what the community sees, right, the visible side. And then specifically a discussion happened around a definition that was given of transient. Right. So a younger group that seemed more or less not, native born or not a product. And that population was present more this summer in certain areas of town, I think more than other summers. It's how do you properly educate the public on the actual issues without this image in their mind of what they saw this summer.
And Jean, you have a lot of experience with that, so you want to speak to what the library does and
Sure. Sure. At Old Town Library, we do have a lot of individuals experiencing homeless who use the library on a near daily basis, and some of them are just fine, and we have no idea whatsoever that they're experiencing homelessness at all. They come in, they do their business, they're using the internet to connect with their family and friends, or they're looking for jobs, or they're looking to connect with various resources available. And then largely the ones that do become issues are facing mental illnesses or have substance abuse type of things going. And that's where we worked with our library board of trustees to come up with an acceptable behavioral use of the library. And we worked with the Murphy Center to help develop those, and also with the police department to come up with those. And it's just a list of behaviors that we feel our community and our library users are comfortable with. And it's worked pretty well so far.
Great. Matt, did you?
We've begun a conversation with Murphy Center, with Homeless Care, with the Fort Collins Rescue Mission, with Catholic Charities, and Todd is part of this conversation now as well, and Ryan and several other business owners in the community, and similar issues occurring in the public spaces in the downtown area, and that has tended to, that spiked this past spring and into the summer. And the way that the community viewed that topic was, I think, not accurately portrayed in the Coloradoan. And as that unfolded, we really thought, okay, we probably have a lot more in common with the managers of the service agencies, the members of the downtown neighborhood, and the things that we were seeing portrayed as a war on homelessness was not that at all. The downtown has always been a place where everyone's welcome. In fact, in my industry, there's a long-standing goal to make downtowns welcoming, safe environments for everyone. But what isn't tolerated is socially unacceptable or negative behaviors that impede on the experiences of all of the other patrons of the downtown area. And that came to play out in new ways for the community, for the downtown community in the past couple of years. As I mentioned, spiked this past year. And as we sat down with David and Zach and Jim and the others, we began to realize that it's a very small segment of the homeless population that actually is contributing to that topic, or to those issues. And it's not unlike the negative behaviors that we don't tolerate when it might be negative behaviors from, I'll use the example of a 22-year-old GI from F.E. Warren Air Force Base that comes down to party on the weekend. There's a code of decorum that's expected of them in the downtown environment in the nighttime. Same with at-risk youth who might hang out in our public plazas during the daytime that are on summer break. There's just a code of decorum that's expected, and that got out of balance, and we're talking in this group about what those behaviors are that are not acceptable, what behaviors are when they become illegal in nature, and how to appropriately have the business community and the manager, the service agency practitioners involved and talking on the same page about those behaviors, and when it's acceptable to seek law enforcement when it becomes illegal, and when it's okay for a business owner to perhaps say, hey guys, this isn't appropriate behavior. It doesn't matter if you're living on the mansion or you live, you are without a home, you're unsheltered. It just doesn't matter. There's just certain type of behaviors that are not acceptable.
I wouldn't understand why someone wouldn't be just either charged for the crime they're committing or asked to stop the behavior they're doing if they're homeless or not. If they're causing a disturbance, they're causing a disturbance. Homelessness shouldn't be an excuse.
Right. What we found out, and what I really liked about those discussions, is that where you might have thought it was a divisive issue from what you read in the papers, it turned out we were in agreement on all these things, and there is a lot of good synergy happening around this issue, and it's like, what was our top issue about a bad behavior in Old Town had nothing to do with homelessness, public drunkenness and what can result from that, like public urination. No one in this room wants that, and that's like, okay, well, that's one of our big issues of Old Town, and then the other things that were clearly illegal, certain drug use and stuff like that. And as we got to talking and just talking about the behavior, again, what the public is seeing and what they're commenting on, we realized we're on the same page much more than we differ. So that was good.
Yeah, I think one of the things that we found pretty quickly is that we're all sort of impacted by these issues, but we're impacted in different ways. So, from the business owner's perspective, the impact of some of these behavioral concerns might be very different as a service provider, and I think for the people we're serving, it still creates an issue. I mean, if you have someone who is experiencing homelessness, who's causing a behavioral issue downtown, and that creates a stigma that then the community attaches to the homeless population at large, that has a negative impact on everyone who's experiencing homelessness, and that's not fair either. So I think one of the things that I've appreciated about the discussion that Matt and his colleague Derek have organized is that we're trying to figure out a way to address some of these behavioral concerns in such a way that we're addressing the behavioral concerns but not making it illegal or not penalizing people just because they're homeless. How do you get at those behavioral concerns without?
I have a suggestion. Why don't you charge people with the crime they're committing? I mean, I've been through downtown, and honestly, I avoid downtown now. I don't think it's very safe. And it doesn't just have to do with the homeless or the college students that are having a lot to drink. It's just a big open space where there's a lot of things that could happen. But if somebody is a resident here or just passing through, if they're causing a disturbance or causing people from getting business at their business, charge them. I mean, I feel sorry for people who are homeless too, so am I. But I still know how to conduct my business in a store or walk through a downtown area to get where I'm going. It's not a place to hang out and just socialize. It's nice to look around, but there are businesses that have businesses there that have business to attend. I don't think they should get like a break for it.
I want to get back to a topic thank you. That was really, really great discussion. I want to get back to a topic that we talked about briefly this morning. I want this group to have the benefit of hearing a little bit of this conversation too, and I'd like to dig a little deeper on it. When public drunkenness came up, I asked if there was a public inebriated pickup program, and we have one in Portland. It's nonprofit run, and basically if somebody is actively using, drunk, or passed out and at running the risk of overdose or anything like that, there's a social service agency that runs a van with EMTs who you can call, and it doesn't have to be the police, but they can pick them up, and they're taken to a place. It's not the drunk tank. It's not part of Milton Park County Jail. It's a different place, but it's a safe place basically where they stay the night. And then the next day, it's also connected to our detox program, and it's also connected to another substance abuse treatment program. So recognizing the fact that, sometimes people just go too far and they're drinking a couple nights here and there, but then also recognizing the fact that some people are really active in their addictions or their alcoholism. It's in the community for those kinds of services or those kinds of responses for people who are still active in their addiction or still suffering.
Presently, this community does not have the service that you described that Portland offers. It's our EMS providers, our ambulance and our paramedics and medics, excuse me, they would respond to a call initiated by myself or a citizen about an observation. And then they would be, evaluated at the scene and maybe treated at the scene or transported. And so at this very moment, it's our emergency room. The topics of a detox center and that kind of a service have been have really never ceased, but they have remained in conversations.
Yeah.
And there may be some energies in different places, but I'm certainly not aware of anything right now that's in the direction of a detox or a similar service that you described. It's our hospital and ambulance that do that.
Yeah, I think the lack of a detox definitely makes it very difficult. It's very overwhelming on the emergency room, especially when school is in session, Saturday night and there's a football game and they've got, dozens, if not hundreds of intoxicated students, and, trying to, determine which people need to go to the emergency room, which people from there then need to get transported all the way over to Greeley and Weld County so that they can actually get into detox. A lot of times, unfortunately, people who in a lot of other communities would end up in detox just have to be left on the street here because there's no room for them in the emergency room. So not only are they not taken care of in the moment, but they're also then not really being connected with long-term care. And that's, the other part that is obviously lacking in our community. Touchstone Health Partners does a great job with outpatient treatment for substance abuse, but we don't have any inpatient treatment in Larimer County. And that definitely has a huge impact. Though one of the things that we definitely have found with the Fort Lyon program, as well as other programs, is that if you do make those opportunities available, people will take advantage of them. It's amazing the number of people who have really long-standing addictions that as soon as they had the opportunity to get into Fort Lyons and know that they actually were going to have a safe place to address their addiction issues, were more than willing to go. But if you know that you're not going to get that support and the next night you're going to be back out on the street and you're going to be sleeping under a bridge, at some point, why not drink? Things really can't get any worse.
Right, sure.
And I have to admit to that too. It is hard being clean on the streets. I've been clean this whole time, but to not use is very hard sometimes when, as you say, it feels very bleak. Some type of treatment I think would really help with some of the, I guess you would call them troublemakers in our group. There are a few, but they cause a lot of headaches here in town every day. We don't know what to do with them either as a community because they're kind of our community. We can talk to them, we can counsel them, but we don't have anything to do with helping them very much either because we don't know what to do.
Any other comments on this side of the circle around that? I will say we did some studies. A couple of places have done some studies, and I don't mean to diss inpatient, but I think it would be really good to put resources towards housing and outpatient services. I think it's just as effective and actually a little less costly because, inpatient can be really helpful for some people too, but often what happens, people are an inpatient and then they don't have a place. Oh, okay. But the idea of having housing connected to those services specifically for folks that are wanting or needing to address it and really completely unable to unless they have a place to live. So.
And I think that's one of the nice parts about the Fort Lyon project is that it ultimately, in a lot of ways, is a housing program. It's not kind of your typical inpatient, but it really is, potentially long-term housing while you're also addressing, addiction issues. And conveniently with a project that large, it allows us to get a lot of people into it, at least until it filled up. But that obviously it would be better if that was in our community and we had housing options like that here in Larimer County versus shipping people all the way down to Lamar to actually get the housing and the treatment that they need.
I had a comment on that too. I'm a resident at Catholic Charities on their 4-month residency program, waiting for my Section 8 right now. I actually got my Section 8. With people that first come into a homeless shelter, honestly, from coming from the streets, being in a tent under a bush, it's a weird experience. Maybe that would be a good place to start with an offer of NA or AA, counseling, brochures, enough information that when they get in, besides having a warm place to sleep for the night and a shower, to have an option that next morning so they don't have to use or become a criminal. They see what they have in front of them so they don't have to go off to another facility, they can start their treatment then. Would that be worth maybe looking into
Sure.
in some of the shelters to start something at the beginning?
Sure. Early and often, huh? Yeah, I agree. Anything else around these? We've been talking about a lot of different things, and there's obviously a lot of complexities around homelessness. Is there anything that we haven't brought up either this morning or this afternoon that you really want to get out there, you want people to hear, and also maybe react and respond to?
I'll add another one. I think this morning we actually talked, a few folks in the audience when we opened it up, talked about how it's so difficult to afford rent or a home in the community, and one of the quick answers was to raise the minimum wage. And I think that's a potential area, but here's the bigger challenge. I think you can raise the wage, but if the skill set isn't there to attain the job, then it doesn't matter what it pays.
Yeah.
So I think one thing we have to talk about as a community very clearly is workforce training and job training to make sure that folks who are homeless, or more importantly, on the verge of becoming homeless, to get them the job skills training that they need to get a better job so they can afford to stay in a home and not become homeless. So I think we didn't talk about that this morning. I think that needs to be a part of our charge, and I think it's a bit of a gap in our community that we have to address.
This is sort of this is a separate issue, but I think I've heard it a few times that education is really going to be important, and particularly sort of all of our charge in this room to go out into the community and make sure that people are aware of the issue, that they have the facts. I think it's a complex issue that people misunderstand very frequently, and like you said, I'm always thinking about who's not in the room. I think the people in the room probably have a fairly well-rounded perspective on the issue, certainly relative to maybe the community at large. And I think the more we can educate people about the issue of homelessness, and I don't mean to put you on the spot, Jeremy, but I just think I think it's a voice that we don't hear often enough, and it's a voice that is really, really powerful, and probably resonates with everybody in the room just as much as it did with me. So I appreciate you sharing it.
I'm sorry to be so quiet. It's just me new to this. I thought it'd be better to listen and see what was going on, since I'm not privy to all this information. I don't keep up with these headlines.
It's probably a good thing not to read the paper sometimes.
I got more important things to worry about in the morning.
Exactly. So one last question. We talked a little bit before earlier about next steps, but now that we've had some other conversation and people have shared from their perspectives a little bit more, it would be I'd like to hear from you all. What is one next step that can take? And in addition to adding that step, who is accountable for that? Who is accountable for taking that step? So if it's a convening, who is accountable for that? If it's a sheet, a triage, who should be accountable for that? If it's something else, if you could add the accountability piece to it.
Sure. I'll take a stab at it. We had a conversation after our morning meeting this morning with Homer 2020, and we think from a convening standpoint and a leadership standpoint, they would be wonderful to be our point person. And then the next step really is to identify a gaps analysis. We've actually identified a few gaps today, clearly, that we haven't been able to address yet in the community. With Homer 21's leadership to convene the group to identify those gaps, number one, assign tasks related to those gaps, and again measure them, I think is an immediate next step. And all of the things we talked about today always come back to education. So we need to continue to do that as well.
I agree too. With the homeless, we're not very educated on what's going on in the city. We learn secondhand most of the time. A lot of us stay to ourselves too. So education and understanding where the city's coming from, I think, would also help, because a lot do not understand exactly what's going on to them sometimes.
Well, I think that might speak to the fact that an immediate next step is we need as a community to do a better job engaging the people we're serving in the work that we do, and coming up with solutions for the issue. And I totally agree with what you're saying. I think what we've identified the need for today really is more conversations, bringing more of these stakeholders to the table to come up with creative solutions to this problem, and then actually working together to address the problem. And I agree that Homework 2020 is in a position to be the convener. Sorry to put you on the spot, Vanessa.
I'll put somebody else on the spot.
No one in this circle is going to end up with any responsibility.
I will say, I think there's a highly qualified team at the Fort Collins Housing Authority that has dialed in on all of the different ways to develop the different housing types that can address the various needs of the different segments of the homeless population.
And not to disagree with David, because David's great. And I do think that we definitely do need more conversations and to keep the momentum from meetings like this going. At the same time, I think we also have to recognize that conversations are great as long as they lead to action. And I think we've had a lot of conversations with a lot of different groups over the last year or so. And I think a lot of times we're looking for the perfect solution, and if we don't come up with that perfect solution that everybody is happy with, we don't do anything. And I think at some point we have to start saying, okay, we're gonna do this. It's not perfect. It's only part of the solution. I may not love every aspect of it, but it's going to start moving the ball forward, and just continuing on a lot of the great work that is already being done, but really moving even more into action beyond just the conversations.
I had a question on that, if you don't mind. I agree with you on that too. My question would be, as someone like me, how do I go back now to the homeless community and explain to them the proceedings tonight? Because they're going to want to know. And I'd like to go forward with something and maybe go to them and say, hey, maybe if we start picking up after ourselves or making an effort to be less aggressive with the police whenever we deal with them, we can get a smoother walk through town or go on to where we're going or stay and become housed. But how do we work with the city now to where we're benefiting towards you too? So we become part of the community and we benefit and give benefit back to the community. How do we do that?
Yeah, Jeremy, I would share with you. First, in the short term, you're exactly right. I think going to people that are in the same situation that you are and saying, hey, look, guys and gals, we're being watched, but in a positive way, that people want to help us, okay? But we have to show that we want to be helped, number one. And number two, we have to exhibit behaviors in the community, whether it's downtown or any place, that we want to be served. We want people to help us. And in exchange, we are going to exhibit great behaviors and help one another as much as we can. That's number one. And the last thing I would say is that you can share with them that there were 80 people this morning and 80 people today taking the time out of their day to come in and have a conversation. So there's a lot of care and love in the community. And I think people need to hear that, and they're willing to spend a lot of time identifying gaps, providing money and resources, and very strong commitment from the community to help people in your situation.
And I think we also need to figure out
I
ways.
want to be mindful of time as a moderator's privilege.
Oh, sure.
Before we close and move to the other group, I want to look to Todd, Jean, or Ryan to see if there's any final comments you would like to share before we...
I would probably encourage the group to think about utilizing what we have in different ways just to get through and help people until we get that permanent housing solutions. Sister Mary Alice Murphy attended this morning, and she had heard about an idea. I mean, a lot of people look at me and go, you're from the library, what do you have to do with homelessness? And quite a bit, actually. and the library would love to be a part of the solution, and so we've been looking at different ways of spinning things differently to where you wouldn't think. She had heard from someone about placing social workers in the public libraries, and we do have a nice relationship with Touchstone Health Partners, and they come in for 2 hours each week, and they send a caseworker, and the caseworker connects with anyone from the community, not just someone from the homeless population or any other population. They're there for everybody, and that's been a really nice partnership for us and for everyone, but it's just that 2 hours a week. So the idea of putting social workers in unique places, or I told her some other ideas of communities that have put doctors and public health nurses in public libraries. I have space there. It's just a matter of figuring out how to best use it. We had also talked about, Jamie had talked about the Daily Show report where Salt Lake City has reduced homelessness by 70%. One of the things that they're now doing is outside funding in Salt Lake City has gone to the public library there. It's a beautiful 6-story building. They've given them 2 years worth of funding to open up their building 24/7 so that anyone in the community can go and use it, whether they're homeless, whether they're students, whether they're just the average citizen, whether they're a parent like me. I would have given anything when I had a colicky baby to be able to go to the library and just get out of the house. And it enhances the services for everybody in the community. So try to think outside the box and use what we have, I guess, is what I'm saying.
Great.
I mentioned this morning, as an engineer, a computer engineer, we had this thing called contextual design, and it was, you sort of model your design after people's practices. So if you're looking at a campus and a student goes from the math department to English class, and you realize that there's cow paths being walked on through the grass, and that's where you design the sidewalks, right? You don't put the sidewalks in a beautiful aerial view that look like a cross, like every engineer wants to design them. You design them where people are walking. And so I think the charge on anyone who takes leadership in this issue is to bring all this collection of well-meaning people and those in charge, and do a gaps analysis, and do scenarios like what's a day in the life of a homeless person of this type, and what's a day in the life of a homeless person of this type, and start to have solutions instead of silos. So what we heard from this morning's session is most everyone in the room very passionate, have a lot of great ideas as to things that they're doing, and oftentimes they're relegated to silos because there is no overarching leadership. So you need that leadership to have a solution. You can't just have individual solutions. You have to have an overarching story to tell someone who's homeless.
I guess kind of a reoccurring theme. I mentioned the collection and the tuning of the resources and triage and some things. And Jeremy and I spoke at lunch briefly. And his situation is unique in that during the course of his hardships and seeking housing, he was able to maintain the faculties to go through those processes. He shared with the audience that he had some struggles, and there were some competing kinds of messages and opportunities that he had. And when I'm on the street, I try to make it it's an educational contact with a visitor, a traveler, a homeless person, or whichever, if they don't already know me. But it's hey, where are you from? You didn't realize this probably because you're from Flagstaff, but you can't be that close to the door smoking a cigarette. Just letting you know that's what's kind of expected here. Let's walk this way. I'll point out a couple places for lunch. Catholic Charities, for example, Murphy Center for other resources for the reception of mail and other services, Workforce Center and the like. My team and I do a lot of that daily. But I think if I were to go into a good direction here, would be to establish a better triage center, because much of the burden now is at the Murphy Center, which does a marvelous amount of work, more work than they actually probably can handle at times, and not everybody gets the service that they need, because the Murphy Center isn't everything.
Right.
It's a lot of things, but it doesn't do everything. And I might like to see that triage point for those things, whether they're simple sort of hurdle mitigation for the likes of Jeremy or others that may not have the faculties or the resources, even the energies to go forward. And I think that would be very important, not only to me, this audience, but to our community.
I agree.
Great. Well, I want to thank you all very much. We are just a little bit over time, but we still have plenty of time for the outer circle of experts. So let's give everybody a hand. That's great. Do I still have to use this, or because we need 2 mics running? So you've got 2 mics running. Awesome. So we've got a hand here and a hand there. And before we start, I just want to say this discussion around gaps analysis came up as part of our work with CSH's work with the City of or with Homeward 2020. We are doing a systems map that will help lift up some of those analyses and lift up some of that information based on data that's provided. And so the next conversation we have following these conversations will include that information as well. So we are working on that. Okay. You're first.
I'm Maggie Dennis, and I am a grant writer. And I'm hearing lots of great ideas here, but I'm not hearing any discussion about funding. So I'd like to add that to priorities. But also I want to get back to, somebody mentioned, or more than one person mentioned, data and the need for data and the need to be able to evaluate that and measure impact on an ongoing basis. And I think from a grant writer's point of view and from trying to get funding to this issue, that data needs to be made available and updated frequently. And we used to have, we have a defunct kind of system for that called Larimer County Compass that hasn't been updated since the 2010 census, I think. I'm looking at the librarian. And we need something better. And Denver is up to something better that's sponsored by the Piton Foundation. And it's going to be a 21st century version of Larimer County Compass that provides data that's constantly updated and aggregated at the neighborhood level. Imagine that. So I would want to encourage stakeholders. I'm working on this, hopefully with the library, to try to figure out how to get this system here to Larimer County. And I would encourage stakeholders to help us find a way to make that happen. Because you have to spend money to make money. So but let's get some data going.
Great point. Thank you.
Hi. I'm Sherry Ryko. I'm with Disabled Resource Services, and I really want to thank the Inner Circle for all you guys are doing. But a little bit of feedback or critique. In the questions about what is the next step, it was asked twice, and one of the things that didn't come up was just, how about checking out funding for new housing? And I was thinking about what was brought up in the very beginning of the Comedy Central Act or whatever, where, why is it the people in Utah, have housing? Well, they got them housing. And we can talk all we want about, finding out the statistics and measuring gaps or adding social workers or doing this, but it seems like and then it went off track a far ways to me when we got into public drunkenness, when it really implied that people that are homeless are the problem, when it's really the drunk people that are the problem. And I just felt like I got way off there, when to me it just seems like the solution, just thought of a song, just house the people living in the streets, feed the children that don't have enough to eat, get to the core and the basics of the problem.
So I was the one that brought up the drunkenness. So I just want to address a couple of things. We did talk about money for housing. We probably didn't spend enough time on housing, and you're absolutely right, housing is the solution. It's true. And so we know that there are barriers to what housing is available, but we also know housing is the answer. So yes, we need more. Yes, we need more funding. But I just want to be respectful of the people in the center. They did bring up some of those things.
I actually have more than one comment, but I'll try to be really brief. The one is about addressing the behavior rather than whether it's a homeless person or not. Well, I live in Old Town, and there is regular public drunkenness and disruption where I live, and we can call the police as many times as we want. They just ignore us. But one day in the afternoon, I saw a police car driving around our parking lot for about 40 minutes, and he stopped next to a guy on a bench who was obviously homeless. He had a huge backpack. And he stayed there next to that guy until that guy got on a bus and left. Now, I don't think there's any law against sitting on a bench in the middle of the day, but there is a law against public drunkenness and disruption and violence. And so you can say all you want that you're enforcing behavior, but in fact, they are going after the homeless. That's the one thing. The next thing is I want to echo this thing about funding for affordable housing, because there are subsidies of all kinds for high-income housing. In fact, they sometimes even call it affordable housing. They say it's affordable housing. It's only $1,200 to $1,500 a month, and these are the buildings that are going up along Mason Street. So, I mean, the city really needs to get serious about its priorities on these things.
I'm gonna ask you to be respectful of other people in the room who
and
want to
I
speak.
want to commend what people have said, but I think we need to, get a reality check and go somewhat further.
Thank you, sir.
Good afternoon. I'm Julie Bruin, the CEO of the Fort Collins Housing Authority. Thank you all for coming again this afternoon. I think that in terms of affordable housing, it's a very, very complicated issue. And I think that the inner circle and a lot of us in the outer circle know that we cannot even begin to touch that conversation in this forum. I think that there are other ways to continue that conversation. I know the city is working on their housing affordability policy study. And I don't think anyone's trying to avoid that topic. It is a great topic that we have at Homeward 2020 and other discussions on homelessness all the time. It's a huge issue, and I just want to assure you that that conversation is going on in the community. It's so complex, I don't think we can touch it in this forum. So thank you, I appreciate your comments, and yours too, Sandy.
I'm Diane Mead. I'm a resident over at Legacy House, the senior housing. Till I moved over there, I had no idea how much of a homeless problem we had, because they're very, very visible, and it's very sad. You don't know what to do. You wouldn't even know how to advise them. You see them lining up. I've done volunteering in various places like the Mission, Murphy House, Homeless Gear, and you see the number of people that are in need. I was very glad that Jeremy spoke up about this problem of the law saying one thing and the other law saying the other thing, and what does the police, what is their imperative? Are they told keep people out of here, keep people out of there? It seems like you need some kind of ombudsman or something that could just, coordinate what's available for everybody and get the information to people. It's great to see so many of you professionals and stuff doing this work. I'm not young enough to do it anymore, but I can still care. It feels so hard to hear when you're planning on doing a study or getting information or getting data. I know all of that's important. But what do these people who don't have any place to go, what did they do when it was so freezing 2 weeks ago with the snow? What I feel that we need is a sense of urgency, that we can't just put this off for another 5 years, that something has to be done. Even one day on the streets must be horrendous. And 2 days and 3 days and months and years, you must feel so hopeless. So you're homeless and hopeless. So that sense of urgency, I just feel we need to look at.
Thank you.
Hi, everyone. My name is Lori Daigle. I'm the Director of Regional Programs for the Northern Colorado AIDS Project. And I've been in the nonprofit business here for several years, and there were two things that struck me. David, you mentioned it, and Zachary, you mentioned something as well. Education is really important, but education without action, and how many of us in this room have done educational programs where we've talked and talked and talked without the action? So it's kind of like my charge to us in the room. Education is important, but let's act once we have these conversations. I'm willing to start acting with anyone in this room to solve this issue, or to at least do something to make a difference. Also, it is a complex issue. So how do we get the people who are not in this room, because they're the ones that are going to make the difference? Thank you.
Yeah. Hi, my name is Desiree Fisk, and I'm a graduate student over at CSU. I just want to bring up the point, and I value everybody in the inner circle who had a chance to speak, and hi, Jeremy. But I do want to suggest, we're talking about next steps, but looking around the room and realizing who is here, I think we need to be careful on approaching these issues top down without including the voices of those who are directly affected. their opinions and their experiences need to be valued more, I think, in these discussions. So.
I think that's a really important point, and because Vanessa doesn't have a microphone, I'll just mention, she's had discussions with her board, and we've talked about possibly having some meetings where people are, and not necessarily meetings where people show up, because I think it's much more comfortable to go to where people already are and have those conversations and discussions. But you raise a very good point.
Hi, my name's Polly, and I've lived in this community for 23 years. And unfortunately, about 2 years ago, I got very ill. And I became homeless. And I'm very educated, and I couldn't work. And without the resources that I got through with David and Murphy Place, I wouldn't be where I am right now, which is in a place. But I'm still scared every day that next month I might be homeless. And I don't think you guys realize on Sunday morning at 6 o'clock or 7 o'clock, these places close where the homeless are. They gotta take everything they own on their back. Nobody cares if it's a torrential downpour, if it's snowing. They don't care. You're on the street. And where the heck do you go during that time other than the library? We need a day program, you guys. We need a day program for families, we need a day program for men, and we need a day program for women. And that's my experience, and it can be done. Somebody's got to address that a lot.
My name is Alex. I'm on temporary staff at Catholic Charities. Been working here for the past month. And I've worked with Jeremy, and I've worked with a lot of the homeless at the mission very closely. And one thing that I've really noticed is when it comes to kind of addressing the root of homelessness, for the majority of these people, they've grown up and they've entered into these antisocial and destructive behaviors that cause them to kind of push everyone away. So as where with most of us in this room, if we were to lose a job or come into economic hardship, we'd have a support system of friends, family, excuse me, of other people we could stay with. A lot of these people have not necessarily defaulted their own, but have pushed everyone away from them. And so the root of homelessness seems to be these behaviors, and it's been brought up a lot, is that mental health assistance, counseling, rehabilitation programs that lead into housing are what's key. You can't just throw someone in a house and because they're gonna find themselves on the street in a week. It's not, the permanent solution is love, and love through counseling, because a lot of the cause of this is growing up in broken families, growing up in families that have been broken apart from divorce, where the father wasn't present or they were abused. And so the medium-term solution is mental health assistance. The long-term solution is helping to fix the family.
Thank you. I think that positive relationship building is really important. Yes, ma'am.
Hi, my name is Cheryl DeStasso. I'm the coordinator for the Fort Collins Community Action Network. At the beginning, Jean mentioned something about how important it is to educate people that homelessness isn't a crime. It's hopefully just a temporary situation. And I think Todd echoed that, and I was glad to hear that. But then Jeremy talked about how when there is no place to sleep in shelters, you have to camp. And what happens in our community when that happens is people are often ticketed. So doing that is really nothing less than criminalizing behavior that you have to have, which is sleeping. So we're criminalizing homelessness. And where I agree that that there's some behaviors in the library and downtown and everywhere that shouldn't be tolerated, I think there's other behaviors, as Sandy pointed out, that is sitting on a bench with a backpack. And I really do think we need to get very honest with ourselves about which behaviors are being targeted because people are homeless, and which behaviors we can all agree just shouldn't be allowed. So I think we really need to stop criminalizing homelessness.
My name is Joe Kwiatkowski. I'm just a resident here of Fort Collins. I just want to pose a question. Suppose a woman and a child show up at Murphy Center. It's Friday, Saturday, Sunday night. No money, no shelter, nobody, that they don't know anybody. What happens? Is there a duty officer they can call and say, hey, help me out here. I got to be pointed in the right direction. What happens in that circumstance?
So, we kind of made this rule that you shouldn't ask anybody in the center circle any questions because we want to make sure we hear from as many people from the outer circle as possible. And if I didn't explain that, that's my fault, and I own that, and I'm sorry. If there's someone in the room who could quickly respond to that, if there is a quick response in the center or otherwise, yes.
Hi, my name is Guy Ment. I'm the director for Catholic Charities. And one of the things we provide is shelter on a nightly basis, both for program participants, like Jeremy's part of our Levels program, and that's shelter for up to 120 days while the participants try and work on issues that were leading to their homelessness and trying to work out a plan for housing, as well as nightly shelter. Part of that nightly shelter program, we do have a family room at our mission where families can come and stay for the night, a night at a time. They qualify for that. We oftentimes get more than one family. When we have more than one family, we have motel vouchers that we make available to people, and we put them up in local hotels and motels here in Fort Collins. We do have limited funds that we have for that, so we try to encourage people to work a plan with the Murphy Center and with the counselors at the Murphy Center in terms of coming up with alternatives. But we try to make sure that no one, if they're aware of the service that's available, is sleeping on the street at night in the wintertime.
My name's Kelly. I'm director of Neighbor to Neighbor. We're one of the stable housing providers in Larimer County. So thanks to everybody for offering such good insight into this. I think it's important to note that as an educational piece, people do not want to be homeless. People do not want to be poor. So I think we can start there. Everybody wants to be sheltered. So if we can look at that, in Fort Collins, we have such a shortage of units. People can get a voucher, and I hope you're able to find a unit once you do, because we have a lot of folks that get their voucher and then they don't have anywhere to use it. So just this week I had an email from someone trying to figure out what to do because his voucher expired and now he's kind of starting back at square one. So I'd really love for our conversation to continue to address the next steps toward making more affordable development possible. It's rather expensive, and I also wanted to point out thank you to the Housing Authority for their leadership in permanent supportive housing. We are so excited that Red Tail Ponds is coming. I mean, so overjoyed. So thank you to Julie and Chadwick and their team. And the other thing I wanted to say is maybe as a community, we can look at some of those guidelines and things that we have on the rule book, like 2+U, that really hurts the families that we're trying to keep in housing. So thanks for that.
Hi, my name is Emma. I'm a student at CSU. Over Christmas break, I actually went to Houston and I got to see a lot of the homelessness in Houston, and it's very cold and very wet there right now, as you might imagine. A friend of the family took me to several AA meetings to have me experience a high bottom and a low bottom AA meeting, as well as 24-hour AA meeting clubs where anyone can go anytime. And I might be wrong, but I don't think we have any 24-hour clubs here as far as like AA or NA. You know, and anyone can go in, whether you have a problem with addiction or if you're a homeless person, you can still go in. You just have to be sober, which is something that we also need to work towards. I think it would be great to see if some buildings could be donated or funds allocated to buy buildings for that kind of business, like I guess it's not a business, AA or NA. So, yeah.
Thank you. I think raising those support groups is also a really important thing that we haven't talked a whole lot about yet today.
I'm just a resident. My name's Marion, and I came here because I saw the article in the paper that we were having a conversation, so I'm concerned about this problem. So what would be most helpful to me as a resident is that there is one place to go where I can see what is needed from the community, because I think there's a lot of people that will be willing to help and donate money, donate time, donate professional services. And I think if you communicate that through the newspaper, which is how I found out about this meeting, social media, if you have some organizations that are involved in this Homeward 2020 and you have that information available, posters, I don't know. And the second thing I would say is I would love to see people that are homeless the homeless population be involved in kind of a task force. They're involved in all the conversations. There's a group of homeless people that are involved in the strategies and in the solutions. But there's a lot of people in the community that want to help. And so if we have this one place to go or two places to go, and you show me a list of what's needed, we're going to respond.
That's a great idea, sharing some sort of clearinghouse of volunteer opportunities, funding opportunities, I said volunteer, sorry, but ways to help, yeah.
Marianne, thank you for the transition. My name is Lauren Gustus. I'm the editor at the Coloradoan. And we had a little bit of discussion about some coverage of the issue here earlier this afternoon, and I think that's absolutely great feedback for me to hear, for us to hear. So thank you for that. And I'm here because we want to be part of the solution too. We don't exist to cover the bad or the salacious or the, here's this great, tremendous problem, and we don't want to be a community partner who's involved in the solution. So I would say, as we reference that clearinghouse, that space where we're looking for leadership, where we can help contribute to a positive, constructive conversation and develop a more sophisticated dialogue, engage with us through Homeward 2020, through Bohemian Foundation. We want to be part of a constructive solution for Fort Collins. So.
Thank you very much.
Good afternoon. I'm Betty Anderson. I am a resident of Fort Collins for about 40-some years and live in Old Town near Riverside. I wanted to thank the Inner Circle very much, and also all the other people for everything that they've said. You've covered pretty much everything that I've had on my little list to talk about. The only thing that I wanted to add was transportation. There's a huge difficulty for people to get from point A to point B, and whether it be from one resource provider to another resource provider, or whether it be to a job and back to wherever they're staying. I would like to see something done as far as making transportation costs for people who have no car and are homeless be eliminated and easier for them to get to those places.
Wonderful, thank you.
I wanted to introduce myself. I'm Gail Marie Kimmel. I'm the new administrative director with Faith Family Hospitality. And for those of you that perhaps don't know about us, this is a coalition of now 26 congregations that have been able to establish a rotational sheltering of 4 families per week. And they do have to move from congregation to congregation, but we are able to keep families off the streets. And if I understand this is week 3 on the job, so bear with me. But if I understand correctly, in the 3 years that we've been around, we have been able to assist 57 families, and we've been able to see a 38% move into permanent housing. So just know that I think this is a continually emerging resource for our community. We also do have a day center, to answer one of the questions. At this point, we are open 4 days a week, Tuesday, Wednesday, Thursday, and Saturday. And that's really primarily limited by funding and volunteer energies. So we are able to serve the families that are moving through the congregations for their meals and shelter by providing daytime access to laundry and showers, as well as the families that are on our wait list. So just know that's another piece of the mosaic in terms of the community here. Thanks.
Thank you for that information.
Hi, my name is Katie Abeda, and I'm the Transitional Housing Manager at Crossroads Safe House. And something I've noticed throughout this conversation is there seems to be sort of a binary in the room between whether people need to have their mental health issues and substance abuse issues first before they can receive housing, or if housing is the first thing priority we should look at. And just speaking from my experience working at Crossroads, I think a lot of times we have the expectation that people need to have these things under control before being able to to be successful in housing and to keep their housing. And to some extent, I do agree with that. But we can't expect people to address these issues when they're worried about where their next meal is going to come from, if they're going to have a roof over their head for the next week or two. Many people in emergency housing at Crossroads, we're trying to work on several different things with them, one of which is, of course, is safety. And if those things aren't being met, then we cannot hope to get people stabilized and with consistent mental health and consistent substance abuse treatment, because it's not the priority that people are looking for. So I think making sure that housing is really available first and foremost, and then everything else can be addressed after that.
Mike Prusnick, Fort Collins citizen. My question or concern is, how do we determine who we decide to help? If you build your house in a fire zone and it burns down, we'll help you. If you build it in a floodplain and it gets flooded, we help you. If you make a bad decision driving through our town, we'll help you. But there seems to be this attitude with the homeless population that, oh, you made this choice, get yourself out. Oh, you're a transient, it's not our job to help you. And I'd like to bring that question to the table. Thank you.
My name is Steve Raymer. I'm pastor of the Fort Collins Mennonite Fellowship. And just to go back to why do people become homeless? The major reason is financial. High rent, low wages, unemployment. I know, I agree. I deal with homeless people a lot. I know it's complex, but I think there might be some simple solutions. And as we've heard from The Daily Show, provide them a house. That's simple. But it takes courage and commitment and political will. So I think there's need for political will in this community, and hopefully the politicians work for us. So if we have the will and we really want to solve homelessness, then maybe we need to put some pressure on our city to up their contribution. And the more they spend on it, the more they'll leverage from all these other sources. Then there's the supply of people going to homelessness through health care problems and through low wages. And I do find myself wanting to advocate for economic equity in our society. That happens to be my religious conviction. But I think things like raising minimum wages and providing jobs is a good way to keep people from losing their house. And again, that takes kind of some political courage, and it takes some will of our politicians to say, yes, we can pass those laws, but it takes us as citizens advocating for them to do that.
I'm a temporary Catholic Charities helper, like him on a 30-day help. Just one thing with education, which when I've been interacting with the different volunteers, I've really been trying to get in and see who's helping, and also just permanent staff. One great thing I saw a guy doing with the education is like those people that who are your hands and feet, maybe the secretary who is the more clerical, or those volunteers in the kitchen. Just maybe making sure you're all on the same page, in that sometimes I've seen this attitude among a few of the volunteers where they feel good doing some assistance and they have a good heart, but sometimes they treat it like not relational, like I'm just doing this volunteer thing, but they maybe view them as a little more permanent, just the homeless, but more that the homeless are part of a community, and through your examples, you guys are on fire in the circle to help them, and then lead by relationship among those people who are your hands and feet, and make sure they're on the same page. Because sometimes the homeless come up to them, and that's their experience of your organization, and we just want, just be helpful to educate them that way, to be in relationship with them and show them how to interact in a relationship with them as well. Thank you.
And one thing I wanted to mention that I forgot to mention earlier is that people are taking notes, so we're getting down your comments, so don't feel like you're saying it, it's just sort of floating off somewhere. We are collecting this information and taking notes, so we're going to pull it all together and come up with some summaries from these meetings today. So anyone who's not had a chance to speak, who would like to share something that's burning.
Good evening. I'm Sharon French, and I am new at the Fort Collins Rescue Mission as a temporary staff person, mostly working with the women, but myself, I can understand, and Esteban, I totally believe what you said, that, if we can just work with them, be the hands, be the feet, let them see how we relate to each other and get into those relationships, I believe that our community can conquer this problem. And the way that I think we can do it is like through the different social connections, the churches. I'm thinking that I see women out there alone, that they're walking out on the street every single night. And for whatever reason, they're not mentally capable to stay in a shelter because they choose not to be. And it's really heartbreaking to see that. I'd like to find a place that would be like a clearinghouse. Maybe we could find some families, maybe different churches. I'm the former chaplain at the Larimer County Detention Center, and for over 23 years I was there. And I see this problem going on and on and on. And now again in the Fort Collins Rescue Mission that's been taken over by the Denver Rescue Mission. And it's changing, it's helping a lot. We have different programs there. We're housing men, we're housing women. We don't have families. We have a couple of different programs now. We have a sober, getting your steps to success program for men and for women, which is a more concentrated, hands-on training for them and addressing all these things that we've talked about today as far as finding a place to live, getting some mental health, getting health, physical health. And I think if we had some type of a clearinghouse, because a lot of times I see that there's real health needs. And if we had doctors and nurses and dentists that we could call upon that would volunteer their services, and also I believe for houses, if we could get some individuals maybe in a clearinghouse. I just was wanting to see if there's some place that we could call that to get a clearinghouse for the women, men, whatever, because last night, even I saw a woman just out on the street alone. If we could get that action
I think that
going.
resonates a lot with what a lot of people have said, so thank you very much.
Hi, my name is Ben Story. I have worked with Faith Family Hospitality and volunteered at the Murphy Center. So I've interacted a lot with folk experiencing homelessness. Actually was told by the school district that my family and I are technically homeless, as we live with my in-laws in a doubled up situation. But we have a stable, healthy, supportive environment. And I think one of the underlying causes of homelessness is fear of the unknown. And I think one of the easiest things that each of us can do is become known and allow someone that is homeless to become known to you. Because in doing that, we begin to address this problem of relationship breakdown. We begin to rebuild community as we get to know people. They're not just numbers, they are people with stories. So if we can take that little step of overcoming that fear, some way connecting with somebody who is experiencing homelessness, I think we'll go a long way to solving this as a community.
I think that's a beautiful way to end, so thank you very much. Thank you, everybody. And I'm just going to pass it on to Vanessa to talk about, to wrap it up and do next steps, and thank you.
Yeah, I just wanted to quickly say thank you again for all taking the time this afternoon. This has been an incredibly just helpful 2 hours, and I hope that you enjoyed the process as well as learned something and found it valuable yourself. You will be hearing from us shortly, and I think one thing that I heard today was just that need for action, and that's something that we certainly want to carry through on. And so we'll be keeping in touch with you very soon, but then, keeping in touch with you after that to really figure out those next steps where we can really start to see some action and see the needles move in the next 6 months, in the next year, and in the next 5 years. If there's anything that you didn't have the opportunity to say in this circle, but you still want it captured, please write that on the back side of your evaluation form, and also please fill out that evaluation form. We would love to hear your feedback. And with that said, thank you again. Really appreciate the time and look forward to keeping in touch with you all.